Hey everyone, ¿cómo están? How's it going? I'm sorry if I look a little comfortable. It's because I am. For those that are aware, I hurt my back on Monday. I've been going to the gym excessively, working out a lot, and it seems like I really hurt my back. And that's why in this video we're going to talk about healthcare, insurance, and just about anything medically related here in Buenos Aires, Argentina, and throughout all of Argentina. So my back, I hurt it and I went to get an MRI, and that costed me around $95. And pretty quick, rather quick, I got the appointment for the very next day, and I had the doctor read me the graph, the video over the phone, so I have like the video evidence of everything there. And I seem to be okay. I just have a herniated disc and I'm in a lot of pain. It kind of hurts to sit down, stand up, and walk. But believe it or not, I'm a lot better, and it's only been less than 3 days. It's been 3 days. And I've been able to walk and do a little more stuff here throughout the apartment because I hate to slouch. I hate to sit down and be a couch potato. I'm usually very active, doing things all throughout the day. And I usually like to go out at least once a day and do things around the city. But I've been staying home, I've been behaving, and I've been just trying to feel better. So about medical insurance, we're going to tell you, it's me, myself, and I, going to tell you that healthcare in Argentina is free. So they have free universal healthcare. But there's currently a dengue pandemic. If you're not aware with dengue, it's a virus, it's a bacteria. I'm not sure what it is, but you get it from the mosquito and you get high fever and you get very sick. You get, your body hurts. It's bad. I've heard from various people telling me that it's worse than COVID. It feels worse than COVID. I believe it's not as deadly, at least the strain, the variant that's here in Argentina, although there's been a lot of, deaths in the country, but as opposed to 40 million inhabitants, which is, I believe, the population here in Argentina, I believe it's 40 million. It's not that bad. COVID did a lot worse. COVID affected the world a lot worse. So not getting into viruses or anything like that, but the dengue, it's something that's happening now, and some of the hospitals, I believe, are at higher capacity than usual because of this. Although it's not something, so blown out of proportion like people are making it, like the news is making it. It is something that's happening. But aside from that, public hospitals are free here. Public health care, even the ambulance ride here, it's free. I don't know how it is in your country, wherever you're watching from, but those familiar with United States, just like I am, an ambulance ride will cost you an arm and a leg, literally. So if you're losing an arm and a leg, and they save it, you're gonna still lose an arm and a leg, at least money wise, because in the United States, even if you do have a good insurance, you usually pay a very high deductible, and the insurance usually only covers for a certain amount. After that amount, you're going to be paying, a big percentage of that. At least for my insurance back in the United States, every year I had to cover like $1,300 deductible. So basically, the first $1,300 that I spent on any medical care had to come out of my pocket. After I spent $1,300, then the insurance kicked into effect and would cover 80% of everything else. But even consultations or anything like that, I would have to pay like a $25 or $50 copay. And I believe it's probably even gone up because that was 3 years ago. And for the last 3 years, I have had no insurance. So in the United States, insurance is expensive. You'll be looking to pay anywhere between $150 to $400 a month, and possibly even a lot more, depending on your age, depending on your city, and depending if you have any pre-existing conditions. So that means if you've been suffering with something, if you have any diagnosis, you might be paying a lot more. So that comes into play a lot. Now, insurance here in Argentina, I remember last year, a lot of people that I spoke with told me that they're paying anywhere between $80 and $100 a month for the absolute best insurance coverage here, which I believe, They have Swiss Medical, they have a lot. But I believe OSDE, OSDE, if you're here, if you're visiting Argentina and you want to look into the best, I believe it's OSDE, OSDE. And health insurance here is called Obra Social. Obra Social, that's what health insurance is here. So basically, the best health insurance last year was running around $100. This year, with more inflation, it's been expected, and as Argentina has been suffering for the past couple of years, well, for many years now, but these last 4 or 5 years, ever since the pandemic, the inflation has been rampant. It has been easily over 100, 200% every year. So with more inflation this year, cost of living going up and everything else, health insurance as well here in Argentina went up. But this is the bright side. It's only around $140 a month, according to someone that I spoke with. A lot of people told me around 120 to 150, so that's around the average, $130 a month. Now, that being said, your insurance here covers everything. Side note, sé que es mucho para los argentinos, sé que es un dineral, no estoy diciendo que no, pero para los extranjeros es buena oferta. So what I just said is that I know it's a lot of money for the locals, for the people that live here, but I meant for the foreigners, it's cheaper, and it's, oh, wait up, I have ice in my back, and I forgot I had ice in my back, put it in a little bag and in a sock, but yeah. So basically I have to crouch down like this, and I have my back brace, because it really hurts. And I have my images there. Maybe I'll be able to get up, but I don't want to get up because I finally found a comfortable position. So yeah, I have a hernia and I have to be, resting. But as I was saying, insurance here covers everything. When you go visit a doctor, you don't have to pay a copay. When you go get any type of surgery or any type of treatment, it covers just about anything. I'm not sure if dental and vision is included, but I'm saying just for about anything else, it's going to cover your MRIs, it's going to cover your prescriptions, it's going to cover just about anything. And I think if you have the insurance, depending on which insurance you have, even the basic ones will cover 60% of your prescription. And medication here, it's a lot cheaper than the United States. I got some pain pills, but they're not any of those crazy things that give you dependency on it. It was just, I have it here somewhere. This, but I'm only taking one a day. I'm taking a different one that's anti-inflammatory. It's like a ibuprofen, the other one I take in the mornings, and then this one I take at night. So, and it's actually recommended to take one every 8 hours, but I don't like depending on pain meds, and I don't believe, they do a lot for your recovery. I believe they help ease the pain, but I don't believe that they will, cure you or fix you. So that being said, you do as your doctor instructs. I'm going to follow my own advice. But yeah, those pain meds, this was 10 pills, and I paid a little under $10, so around $10. And actually, I went with no prescription at all. And I got this. The doctor prescribed me something else, but yesterday I was very immobile. I didn't really want to move. I was in a lot of pain, so I haven't gone to the pharmacy. Luckily, there's a pharmacy right around here, so I'm just going to probably go, tough it out and go later on today and get whatever the doctor prescribed me. He also said within a week to 10 days, if I'm not feeling better, to go to a physiologist, something like that, which I believe is like a physical therapist over here. So and he gave me the prescription for that too, go to 10 sessions, he said, but I'm going to see, because I'm actually trying to stretch and trying to do little movements here, because I know rehab is the best therapy. Laying out in bed is probably not the best solution, because you need to move and your organs need to move, and it's just going to make you sicker just to stay down. And like I told you earlier, I'm very, very, very active, so this is killing me to stay here. I'm trying to finish Netflix, trying to watch as much Netflix as I can. In this series called Alpha Males, I believe it was filmed in Spain, but they have the English version as well. But whatever, it's alright. If you're, you like a romantic comedies or relationship drama, watch it. You'll enjoy it. I don't know if you've seen it already. But yeah, trying to go day by day. But yeah, insurance here, it's not the worst in the world. Although it's getting expensive for the locals, 150 bucks a month and it covers just about everything. And you have a large network of doctors. Obviously, if you're waiting for the certain doctor or a certain office, sometimes, your appointment's going to be 2 or 3 months away. Who knows? That happens everywhere. It was very common in the United States. It happened to me. But what I could always recommend is just call around. Don't just stick to one doctor. Just call around. Try to see various doctors, especially if it's free. Go see maybe one or two of that same doctor, even though they're not, your favorite doctor or the highest rated doctor in the network. Just get various opinions because that might help you along the way. So I personally don't have insurance and I'm paying out of pocket, but that's because I didn't expect to get hurt. Well, who does? And I've been very active and been very fit and healthy. And last year, when I was in Colombia for 2 months, I made sure to do a lot of checkups since there it was just as cheap as here and a lot cheaper in the United States. So since I slacked and I didn't take advantage of the healthcare system here while I was here, paying for my visits, I made sure the little time that I spent in Colombia before heading back to Miami, that I visited a lot of doctors, a cardiologist, and I did a lot of treatments, and it went really well. So I was very happy. It gave me a boost in energy. It gave me a boost in confidence to know that I am, physically fit and that I am doing well. So that's all I wanted to know, because sometimes, it's normal to get scared. It's normal to be afraid that something's probably happening to you or that you're feeling weird. It's just normal. It's just normal behavior, and sometimes a health checkup kind of helps you, get back to ground and know whatever you're facing with, whatever you're dealing with, and let you know that you're going to be okay. That we all have health problems, that we all have health scares, and that we're all a little cuckoo in the head, So it's fine. It's part of life. So you just have to move on. You have to stay busy. You have to stay active. And you just have to try to be productive and do the best that you can. Do the best that you're available. Don't compare yourself or your effort to someone else. We all move. We all have our own very different pace. We all deal with situations differently. We all deal with finances, with struggles differently. The good thing is the motivation is you yourself know, what you have to improve. You have to listen to that little voice in your head. If it helps taking notes, if it helps writing it down, do so. But back to insurance. It's affordable here, covers just about anything. It's around $150 a month, depending on your age as well. And that's actually probably like the best coverage, around $150 a month. And you're going to be able to find a lot of good physicians, doctors, and surgeons, nurses, just about everything. And from my experience, I've gone to very different, hospitals and private practices, and I felt that their level of professionalism was so much more and so much more efficient. Although yesterday, when was it? No, the day before yesterday, when I went to get the MRI, the appointment was already set. I waited just around 5 minutes, and they were very efficient. She gave me a form. I filled out the form. She came back in 5 minutes. And she was very abrupt. She's like, "Oh, put your stuff here, come out, blah, blah, blah." She explained everything cool. But it was like very quick. It wasn't like, "Hey, how you doing?" Like amicable. It wasn't like, but I appreciated that, because I'm not there for someone to, hey, and the small talk and all of that. I believe that slows everything down. So they're very dry, very cold, but it was very efficient. I was in and out, within 10 minutes of being in the clinic, I was already in the MRI machine. Praying my behind off, because, you're already in a little pain and you're laying down in this machine just making noises. And, I get a little claustrophobic and I get a little nervous. I got a little panicky, but I just closed my eyes and kept praying and kept repeating the prayer, hoping that the time would fly, and just trying to think of any little happy thoughts, So that kind of helped me out. It was around 15-20 minutes. That's what she said it would be. It felt more like eternity. It felt like a good 20 minutes in that MRI machine. But whatever. What helped? That the air was very cold. I was easily able to breathe. And I just kept breathing and stayed still. And before you know it, it was over. And I was on my way back home. So that really helped out a lot. And thankfully, I made a friend here in the building, and she came to pick me up, and it's very, very, very good. It's very, very good. Sometimes in other places you get injured, no one checks up on you, no one comes to visit you, no one gives you a hand. But here I've been very fortunate that I had, a friend come take care of me and make sure I was okay and pick me up from the hospital. So that was very good. So as I started this video, I said universal healthcare is free, but that even without the dengue pandemic, without the dengue situation coming out, that they say that the hospitals and emergency rooms are a little more crowded, even without that, I believe it's not the best option unless you need it, because there is a lot of poverty in this country and there is a lot of people. And although you may not be removing their chance to be seen by a doctor, you may not be removing, their position just because you're gonna go get the free healthcare. Doesn't mean you're removing their opportunity to get free healthcare, but it may mean that you're making them wait a little longer, because every patient takes about half an hour of the doctor's or physician's time, and it takes some funds out of the hospital system. And a lot of these people are working class people that spend all day working or traveling by bus or have to travel far away, probably for hours just to get to the hospital. And they have limited time in their hands. They have to go back to their house and feed their family, do the groceries, and wake up with pain, with whatever condition or disease or illness that they're suffering with. And if we're gonna just take up their time, it's probably not the fairest thing if we're a tourist or an expat. You do as you wish, you do as you can. That healthcare is there to serve you. So if you need to, I'm not someone, to make you feel bad about it. I'm just saying be conscious about it. Like I said in the previous video, if you could pay, if you could afford it, it's very inexpensive. Like here, the whole procedure is going to cost you way less than a doctor's consultation in the United States. United States, just a consultation, just for the doctor to go into the room and examine me for 15 or 20 minutes used to cost me around $200 or $300, which was crazy. Just for the doctor to write me a prescription. Sometimes I already knew what I had and the doctor already knew what I had, but I ran out of prescriptions, I ran out of refills, and I needed to renew that prescription. I needed to go to the doctor's visit just to get that prescription. And just for that, I would pay $200 or $300, plus whatever the medicine cost. And here, just the whole prescription, the whole consultation, and even the examination or procedure is going to cost you probably less than $100. Telling you, I went to an ENT to get my ears checked. It was she probably spent half an hour or more, examining me, doing different tests. And that whole visit was $19, that whole visit. So it's pretty incredible, the bargain. I got a deep cleaning for my teeth. I went to a dentist. That was around $15. $15 for a cleaning, without any insurance. I'm talking about. I pay no insurance. I pay out of pocket. So just call around, get options, call the private practices. Where do you find these doctors? On Google. You look for whatever specialist you're looking for on the Google Maps, and you're gonna find. Put the area that you want to search and search that area. Same thing goes for massage therapists. I'm paying around $8 for an hour massage. Last month I paid around $10 for a chiropractor. $10 for a chiropractor. It's pretty incredible. A psychologist, they range around $10 to $20 a month. I know a really good one, and she charges $20 a month. I mean, $20 a session. I'm sorry, $20 a session. But she speaks English. She graduated at one of the top colleges here, UBA, and she has a lot of accreditations with anxiety, with stress relief. So she's a cognitive psychologist, I believe, cognitive therapist. So you could reach her remotely. She does remote sessions over the phone, video calls just like this, where you just look at each other and talk. Or you could just look at her. If you don't want your camera to be on, you could do that as well. You'll cover your camera with your finger just like that, and you'll be able to see her and she won't be able to see you. But she's just a breath of fresh air. I did a few sessions with her and I really enjoyed it. But yeah, you could find some cheaper, but that's the one I personally recommend. And same thing with everything else I mentioned. It's not the base price. Obviously, there's massage therapists that charge $15 an hour. and there's chiropractors that charge 20 an hour. I didn't go to the cheapest, I didn't go to the most expensive. I went to the one that was relatively closer to my house, the one that made sense to me, and the one that I felt comfortable with. So just as everything, take it with a grain of salt. But if you need any recommendations, you could ask me in the comment section, and I would happily send you the details and the phone numbers or the email address, however you would like to contact them. But that's about it. Healthcare, insurance, I believe I covered everything that I personally know, that I personally experienced. And it's just a good country overall. I think every country should have a universal healthcare. Although the new president said he was going to eliminate the healthcare for foreigners, which I wouldn't think it to be the most unfair thing, but I don't have an opinion on that. I think it's a good thing that they are helping out whoever needs help, because we're all human, we're all alive, and just because you were born in one place and you're from a different place, or you were born on another border or in another country, doesn't mean that if you're suffering, if you have an illness, that you should not be treated. That's very heartless to say so, but I know a lot of the locals, I understand, I sympathize with them because they're heavily taxed, and they're in poverty too, and they hate when their own taxpayers' money is going to treat other people that just come to take advantage of the system. So I understand both sides of it. Who knows what's gonna happen, but eventually, the ultimatum is we have to be human. We have to help each other out, and healthcare is something that should never be denied. So it's beautiful that this country has that. Let's see how the new legislation, the new laws portray in the near future. Let's see what happens. But I wish United States will have something like this. I believe Canada has universal healthcare, and a lot of European countries do as well. But I think United States could make some improvements, although they have some of the best doctors and best facilities and most advanced modern technology in the world when it comes to medical and healthcare. But it's relatively very expensive, and it could be overwhelming, when you have an emergency or you need just any little procedure done in the United States. As the situation could be here too, but private practices a little faster, a little better service. Public, it's free, but you may wait for hours. You may even wait the whole day and not be attended, depending, how flooded, depending how packed the hospitals are. But the good thing is there are hospitals throughout the whole city, throughout the whole country, and you're almost guaranteed to get treated and get good health care. So that's about it, guys. Thanks for watching. I'm here trying to get better little by little. Everyone that sent me good messages, thank you. It's not necessary. Please don't do it. I'm gonna get better. I'm a survivor. I'm a fighter. It sucks. I was almost in tears with the pain, and without being able to walk, and I'm happy that the doctor said it was nothing, that serious, and that I'm gonna be okay. Because when you're in pain and you feel like paralyzed, you think that maybe you're not, all these thoughts will come through your head. You're gonna be like, oh, I can't run anymore, I can't ride bike anymore. You feel like, you get scared that may be permanent. So at least now I'm happy that I know it's gonna be painful, maybe a couple of weeks, maybe a couple of months, but I'm gonna get through it, day by day. I'm gonna try to do a little more, and I'm gonna stay tough, and I'm gonna try to be productive these days. But thank you. This YouTube channel means so much to me. I know it's been growing slowly. It's been taking me forever even to get past 2,000 subs. But I'm very happy with the few subs that I have. I'm very happy because you guys are the best. You guys are very active. And you guys have made my lonely days and my sad days feel good, with those little positive comments or just with questions, just with anything. Just even interacting or watching my videos, it makes me happy. But take care, guys. If you haven't subbed, make sure to sub. That helps my channel grow. And make sure to like that video. Press that little like, because that helps YouTube recommend my channel and helps, the algorithm, the matrix, whatever. If you've seen this far, sorry. It's for over talking too much. Take care. It's, I believe, Friday here in Argentina, April 5th, 2024. So Take care, guys. I'm gonna finish watching Netflix. The whole thing.